While processing prescriptions, other red flags will present themselves. Multiplicity is again a factor potentially in prescription number, prescribers, and pharmacies involved. Also potentially at play are geography, your pharmacy's dispensing statistics, and much more. Let's take a look at some of the most common processing flags. Multiple identical prescriptions from the same prescriber indicating a lack of individual dosing. Consumers receive the same controlled substance from several different prescribers.
If it's a customer that has been coming here for a long period of time, we would be okay probably filling that. If it's somebody who hasn't, and it's again a doctor we don't know, we do refuse to fill those prescriptions.
Consumers often seek early refills.
We have a very specific refill policy on controls. We allow somebody to get it 3 days early on a 30-day supply, but anything more than 3 days early, those refills are refused each and every time.
Here are some additional red flags. You rely only on the prescriber's representation that the prescriptions are legitimate and fail to verify details with the consumer. Prescribed drugs are inconsistent with the prescriber's area of practice. For example, fentanyl prescribed by a dentist. The prescriber is located a significant distance from your pharmacy. The consumer's address is a significant distance from your pharmacy and/or from the prescriber's office. The prescription monitoring program shows that consumers are obtaining prescriptions for the same drugs from multiple prescribers. The prescription monitoring program may also show that consumers are filling prescriptions for the same drugs at multiple pharmacies.
Yes, no question about it. That website allows you just to pop in, look up, and that would tell you if somebody's going across, starting out across town or things like that. You can really track their entire history much better than you could if just by your local neighborhood people.
There are even more red flags related to processing. Over-the-counter products, including multivitamins or laxatives, are added to controlled substance prescriptions. Prescriptions are commonly for the highest strength of the drug and/or for large quantities. The prescriptions contain nonspecific or no diagnoses. If you contact the prescriber regarding a suspicious-looking prescription, he or she is unconcerned about your apprehensions or unwilling to provide more information. The number of controlled substances your pharmacy dispenses has significantly increased. Your pharmacy prepackages controlled substances in the same quantity and strength. Click on one of the items on your screen to view another video in this series, or use the links in the description box below to navigate. For a text summary of this video, please see the link below in the description box.